an industry perspective. Assalamu alaikum wa rahmatullahi wa barakatuhu. I am Nusrat Malik Munir. I am a healthcare professional from Mauritius, and I'm here to present the topic Halal Healthcare and Welfare. Now, before starting the topic of the presentation, I would like to thank the organizer, the co-organizer, the collaborator, the sponsor, and the eminent speakers who contributed in this conference. My gratefulness that this is indeed a very unique platform, especially in the time of COVID when all of us are locked up in home, and we get together on this platform to talk about halal sector, what are the development and challenges that are going on. So indeed, it's a commendable effort from International Halal Conference. As we all are in one of COVID-19 situation, healthcare situation, I would like to put a word on how the situation here is in Mauritius. We are on the day 27 of the lockdown, and it's been more than 3 weeks. We are all locked down, and we can see the efforts are being very well projected, as since 2 days the government has done approximately 700 tests and there are no positive cases, so which is indeed very hopeful that this confinement is bearing its fruit. So my one word for all of you is that confinement is working, and all of you, wherever you are, stay safe with your family. And may Allah subhanahu wa ta'ala lift this COVID-19 from all of us. So now coming back to the topic, as I mentioned, I'm a healthcare professional. I am not a very well-spoken speaker in halal matters as all of our other eminent speakers, but I happen to be a business development person with an organization which is United World Halal Development, and it gives me immense knowledge and pleasure and in creating the awareness of halal sector. And when it comes to healthcare, as I'm a healthcare professional, so I was keen to deliver this presentation to all of you. Now, I would like to start, as you say, I'm not an expert. I would like to start with the dua that Rabbi Shrihli Yassirli Amri Wahlul Uqdatal min Lisani Yafqahu Qawli. Let's start the healthcare and welfare in halal sectors as an industry perspective. I was going to talk to you about. I would like to come straight to what is the healthcare sector. A healthcare sector consists of the businesses that provide medical services, manufacture medical equipment or drugs, and provide medical insurance or otherwise facilitate the provision of healthcare to patients. So we can classify a healthcare sectors in broadly in 4 terms, and all these 4 terms which I'm stating you here, like the drugs, the medical equipments, the managed healthcare, and the healthcare facilities, they are one subject vastly discussed enough, but I'm going to put all together in this presentation. So as you see, drugs, you can also know these drugs as a pharmaceutical products. We can further divide these pharmaceutical products into biotechnological firm, the major pharmaceutical firms, and generic drugs. So biotechnological firms are those who are engaged in research and development to create new drugs. Like, for instance, we're going through COVID-19, and most of the biotechnological firms are looking for the cure of COVID-19. They are working on the vaccination. So these are the biotechnological who are solely engaged in research and development. Then there are those who are major pharmaceutical firms who also engage in research and development, but they tend to focus more on manufacturing and marketing on the existing portfolio rather than looking for the breakthroughs. And then we have the generic drugs. The generic drugs are like specialized drugs which are identical, and for the same drug, you can have lots of generic drugs. Like for paracetamol, you have many brand names. So this is a bit about drug industry. Then you come to the medical equipment or medical device industry. Medical equipments are the medical equipment makers range from firms that manufacture standard familiar products like scalpel, gloves, bandage, forceps, to those that conduct cutting-edge research and produce expensive high-tech equipment, such as MRI machines and surgical robots and Medtronics. Medtronic is one of the example of the medical equipment companies. Then we comes to managed healthcare. Managed healthcare companies are mostly those who provides health insurance policies. Nowadays healthcare has become a very expensive thing, and everybody looks forward for a health plan or health package or health insurance policies. So all these industries like banking, insurance, and all comes in managed healthcare, who provide healthcare facilities, health plans, health packages. And the fourth one is healthcare facilities. So healthcare facilities are hospitals, are clinics, the labs, the psychiatric facilities, the nursing homes. All these examples are from the healthcare facilities. There's another term in our presentation, which is the welfare. Now, welfare in itself, it's a very, very vast subject. And in terms of healthcare, it's all about which comes to for a nation. I would like to quote Al-Ghazali, expresses this concept of welfare, saying the objective of Sharia, it's like the Islamic principles, as far as people are concerned, is fivefold. So it's all about the protections of five things. It's about protection of your religion, your life, your mind, your offsprings, and your property. So you see, there is a very important factor, one of which is mind. Mind is mental health. So when it comes to welfare, in Islamic Sharia, we look for all the aspect of life, be it mental, physical, economic, social, or everything. So everything that implies promoting these five things are good. They are maslah, interest, and everything that implies harming these are mafsada. So everything which is harmful to our religion, to our life, our mind, our offspring is prohibited in Islam. So in itself, we can say that halal healthcare is as much there in the welfare in Islam. That's why we call it a welfare, Islamic welfare. The next slide is something which is what giving the shape to this presentation. And this is about the health guidelines from Quran and Sunnah. Now, I would like to really quote this hadith from Abu Hurairah radiallahu anhu. The Prophet sallallahu alaihi wasallam said, "There is no disease that Allah has created except that He also has its treatment." And how hopeful is this in the times of COVID-19, that there is a cure for it, and people just have to look for it, and how we can solve this puzzle of whole COVID-19 is all in there. But at the same time, I would like to say that the Quran is not a book of medicine. It's not a book of health sciences, but in there are hints which leads to guideline in health and diseases. So Prophet Sallallahu Alaihi Wasallam has been sent as an example to mankind, and his traditions in matters of health and personal hygiene are also a guide to us followers. So we can start the discussion with the following verses, which says that everything good that happens to you is from God, and everything bad that happens to you is from your own actions. Therefore, we can say that the disease here is defined by the famous pathologist William Boyd as physiology gone wrong. It is our tampering with the natural process that leads to the unnatural outcomes. And again, I cannot not quote COVID-19, where the process which leads to this unnatural outcome of COVID-19 started from something which is prohibited, is eating a bat or a snake. So you cannot like not wonder and connect these dots, where maybe 3 months before, if you would heard the same words, that everything good that happens to you is from God and everything bad that happens to you is from your own action, you wouldn't have cared less. But now it's all clear, you can see through the words. That's really amazing. It gives me goosebumps also. So as we are talking about what bad we can do in our action, so we can see that there are two aspects to the guidelines. One is the spiritual aspect, and the second is the physical care. So before we come to the physical care of human body, let us talk about the spiritual care. Spiritual care is involves the act of worship, and we can also classify them as our pillars of Islam. So first one is Iman. Now how Iman is related to our health perspective is that Iman is the belief in God, that He is the first and foremost important need for spiritual stability. So belief in God includes His attributes, His angels, His books, the day of judgment, and the heaven and hell, and believe that all good and bad is within His reach. You know, the faith itself, it gives us immense power over, countless problems. Say as a virus like COVID-19, that there is someone who is in control and there is someone who can do good to us. So. Uh, in illness, according to Imam Ghazali, the awareness of God increases, and the man becomes closer to God by realizing his own weaknesses. So Iman is something which is very important when you are sick, and if you don't have Iman, not only when you are sick, even your prayers, your charity, your fasting, your prayer, nothing can work if you don't have Iman. So we come to a next section, which is Salat. Now, Salat here, there are two health aspects of Salat. One is wudu and one is the recitation of Quran. Now, wudu is what? Wudu is washing all the exposed areas of our body, hand, feet, face, mouth, nostrils, etc., 5 times a day in a healthy preventive procedure. This is the healthy preventive procedure, and I cannot again not mention how hand washing is important in today's time, how it's the buzzword, it's the hashtag, wash your hands everywhere for 20 minutes, 20 times a day because of this virus going on. So you can imagine that we are prescribed to wash our hands, mouth, and all exposed part 5 times a day in wudu, which itself has its health benefits. Now we come to the recitation of Quran. Recitation of Quran, on the other hand, has a healing effect on our body. It is mentioned in the Quran that, O mankind, there has come to you a direction from your Lord and a healing for the disease in your hearts, and for those who believe guidance and mercy. So you see that the movement in Salat are mild, uniform, and involves all muscles and joints, and the caloric output is desired to keep the energy balance. So you see how therapeutic a Salat is, which is prescribed to us 5 times a day. We comes to the third part, which is zakat. Now, zakat, the word itself means purification and growth. And through zakat, the purification and growth is of our money. Because money, many of our crimes are committed with money or for the love of money. And in the love of money, one becomes violent in behavior. This is mentioned in the Quran. So in Islam, the ownership of wealth belongs to God, and we are just the disposers of that trust. Therefore, this concept establishes peace at heart and behavior in the loss of money or the unusual gain. In either way, we thank God. So zakat is one form of purification. Then we come to the Psalm. Psalm is the fasting. Now, the Islamic fasting is prescribed as way to train our mind and body to self-restraint. It is mentioned that, O you who believe, fasting is prescribed to you as it was prescribed to those before you, so that you can learn self-restraint. If you have if all the health conscious people nowadays knows that how intermittent fasting is helping them to lose weight and gain their metabolism and all these things which we were prescribed 1400 years ago. So you can easily see the health benefits which nowadays talk so abundantly on intermittent fasting. So therefore, during the period of fast, one may not only get rid of the nibbling food, coffee, smoking, but also anger and excessive sexual passion. In fact, the fast not only gives rest to the stomach, but also stabilizes the secretion of hormones which control our behavior. So you see the health benefit of song in the fasting. The last but not the least is the Hajj and pilgrimage to Makkah. This is an absolute surrender to God's will, the opportunity for repentance, and the social and political gatherings of depicting brotherhoods and equality. When you are together, when you're performing something together, it gives you togetherness and power, and give you that mental state where you are ready to do the physical endurance, the long walks, the heat, the sun, the thirst, the physical exercise. All this remind us for the day of judgment, and at the same time, it fortifies us for this world. So this is what we have compiled through spiritual care. Now we come to the physical health. Now, physical health is nothing but taking care of our body with right nutrition, cleanliness, and the value of exercises. Now, when it comes to nutrition, we have talked long. We have talked and listened a lot on the halal food and nutrition. Allah loves His creation so much that He concerned even with what we eat and put it on our body. So, O mankind, eat of what is lawful and good on earth. So, there are a few things which are forbidden to us, and there are a lot of things which are halal to us. So, the forbidden things are the dead meat, the blood of flesh of swine, and intoxicants. So the blood of the meat of the dead could be full of germs and other harmful elements like antibodies. Pork meat is high in cholesterol, salt, and may have worms and alcohol and other intoxicants that cloud our mentation or inhibition and interfere with our normal capacity of judging good and bad. So the second component is nutrition is not only you eat permissible and lawful and stay away from unlawful. We have another thing is the moderation of lawful in nutrition. Obesity is a major problem nowadays in the form of malnutrition and all this. The right amount of food is important, which is very much emphasized in our Quran and Sunnah. Comes to the next thing is cleanliness. So in cleanliness, as Allah has mentioned, that Allah is pure and likes purity. He's clean and He likes cleanliness. And cleanliness is half iman, this is said. So it has been stressed in Quran so much that cleanliness of body and mind is stressed in Quran. It is not a new invention. Miswak, brushing your teeth. This was stressed as a part of a daily routine of Prophet Muhammad. He also advised us of flossing, hilal, as is now being advised by all the dentists. In fact, he's known to have said that it was not a hardship for Muslim. He would have advised using miswak before each prayer, that is every 5 times a day. Then we come to the value of exercise and maintaining value of exercise and maintaining health. So, though we do not find much in Quran about the specific exercise recommendation, the Prophet's life was full of recommendations. He advised all the Muslims to teach their children swimming, archery, horse riding. He himself used to walk at a very fast pace. He used to race with his wives, Aisha radiallahu anhu. So most importantly, he used to work his hands, whether at home, in the kitchen, or with the companions, collecting wood or fire, during the fights, during the wars. So, it is a pity that Muslims, men and women, have become sedentary, and because of the excessive consumption of starch, obesity has crept into them. We should keep ourselves fit physically for all the ordeals which we're going to do in our day-to-day daily life and for the future. So this is all about what physical and spiritual aspects which are covered in Quran and Sunnah. Now we come to the one which is the one slide which is going to be like halal metrics of human health. How the modern healthcare and the halal initiatives, what is being taken care. So we're going to go back to all the industry sectors of halal sectors. So when it comes to halal, now Malaysia and Indonesia are working a lot on halal pharmaceuticals. Halal pharma is now taking shape. How we can describe halal pharmaceuticals are the drug products that are derived from a permissible source, that is animal, plants, organic or inorganic substance, that follows a method of preparation, manufacturing and extraction, and that follows the recommendation of Islam. In a hadith, Abu Darda reported that the Prophet ﷺ said, Allah has sent down both the disease and its remedy. For every disease, He has created a cure, and hence seek medical treatment, but never with something the use of which Allah has prohibited. So it's very important to seek the medical treatment, but at the same time take care that this medical treatment does not involve anything which is prohibited by Allah. So halal pharma comes up with a big responsibility of sorting out haram ingredient from a medical treatment, which will be beneficial for us in the long run. There is also a hadith that while Ibn Hujr al-Hadrami reported that Tariq ibn Suwaid radiallahu anhu asked Prophet ﷺ if he could use liquor, khamar, as medicine. The Prophet replied, "It is not a cure but a disease." Nowadays we find so many components and products in medicine which are composed of alcohol, and most of the Muslims, we unknowingly are consuming those products. So Muslim scholars have clarified that any material cause drunkenness or alcohol intoxication considered as khamar, which is prohibited. According to a hadith narrated by Aisha radiallahu anha, the Prophet ﷺ said, all drinks that produce intoxication are haram. Also, the Prophet said that every intoxicant is khamr and every khamr is haram. So, it's very important to assess the halal status of any product, and it all depends on sources. So, we are dealing with lots of issues and challenges in halal pharmacology. So the challenges remains when it comes to a consumer or a manufacturer. Our challenges are the sources. The sources which they are coming from. The assessment of halal status does not depend only on the sources involved, the synthetic process also. What are the active ingredients in it? What are the expients in it? So, for example, Some synthetic pharmaceutical products, ethanol is a solid ethanol used during the processing state. If the final product is in a solid state, then the product would be categorized as halal. Because to become a solid state, it has to undergo several steps, including heating or crystallization, in which the mazboo, in which the process will evaporate the ethanol. However, it is considered mashbuh. If the final product is in the liquid form, because of the uncertainty regarding the presence of ethanol, the final product is considered haram, but the presence of ethanol is stated. So the same ethanol, which can be halal in a solid product, it cannot be halal in a liquid product. So you can say it's not just the source, it's not just the alcohol, but the process of it, the process of crystallization, heating, or whatever process is going on. These are all these factors. Then we come to the same thing, hammer, as it's not good, and Prophet and even Quran, in Holy Quran, they ask you about wine and gambling, say in them is a great sin, and yet benefit for some people, but their sin is greater than their benefit. So they might seeing it that it's beneficial for them, but it's sin in the wider sense. Same comes to ethanol, the sourcing and everything. Same comes to gelatin. Now the gelatin is in everywhere. It's not the pharma product, but even the food product. You get so many candies and all these. So you don't know if the gelatin is derived from the plant based, or is it animal based. If it's an animal based, whether it's come from a halal source or a haram source. If it's a halal source, whether the process conducting the slaughtering of the halal source is conducting its halal or no. There's so many things, and alhamdulillah, for all these challenges are halal certifying societies, and HCFs are doing brilliant job in letting us know that this thing is halal certified and all, which is very good. And halal pharmacology is going to develop in most probably in a pharmaceutical program, pharmacy program as well. It should be taught. So these are all about a bit of the challenges. We can conclude that it is a great challenge to convince and educate the manufacturer of the society that the halal product like food and pharmaceuticals are not only good for Muslims, but it's good for everyone. It's for the entire human race. The halal food are very clean. They are safe. They are quality products. They have a standard process of like guidelines, or Islamic guidelines. So in an all, it comes with a lot of challenges. But as the words halal is synonym to healthy, and I think we are getting closer to make it a generalized thing rather than a niche thing. The same thing can be said about the halal medical equipments. Now, what are medical equipments? They are any instruments, apparatus, implement, any machine, any appliance, implant, any software or material intended by manufacturer to be used for human being for the purpose of diagnosis of disease or injury or support sustaining life. We have classified the halal classification from Malaysian standard medical device industry. We have classified into low hazard, low to moderate, moderate to high, and high hazard. So there comes the tongue depressor to the heart wall and implant devices, which have different level of hazardness, and their development as a halal. It's all depends, same like the sources, what are the implementation, what are the process being gone with it, whether the source are synthetic or organic, or what kind of process are being going on. Especially for medical devices, it's not just that the sources and all, it also comes as as whether they're harmful to the environment. The MRI and CT scans and all these are they emit so much radiation which is harmful for our environment. We, as a halal healthcare professional, we are very much keen to develop something which is safe for the environment as well, not only for the person but for the environment, because in the long run we coexist. It's an interdependency of people and environment. So we can say that at present there are various halal concern in the production and application of these devices and equipments. Every country regulates medical devices using its own legal framework. So the World Health Organization requires that each country to have a policy for dealing with any element involving medical devices, including security, quality, affordable product use, and disposal of the procedures. So these all should be looking. Policy will not be successful until it is translated into law. The regulation for medical device industry is important because it can address the issue of public health and safety. In other words, matter of concern to society will be regulated by enforcement of law. And global halal market is estimated to be USD 580 billion annually. So integration of sophistication of science and technology, as well as continuous improvement of facilitate wide range of high quality products, halal products, are so imperative to develop. So we can conclude that at present various halal aspects have become a concern in the production and application of the various products. Unfortunately, halal certification for medical devices has yet to be discussed intensely either in the literature or in the public. This is most definitely an area that requires extensive research and discussion involving the various stakeholders of medical device industry. With this done, we are coming to the managed healthcare. The healthcare companies which gives us insurance plans and all. Now, when it comes to halal initiative, I think we have halal banking and financing, and Takaful is one of the things which are substitute to a healthcare insurance companies. Nowadays healthcare is becoming so expensive, and it's not easy for someone to undergo some health treatments without any security and plan. So in that extent, Islamic finance is doing very good thing, which is ethical, which doesn't drain the person who's paying on the other hand with unnecessary riba and all. So managed healthcare is also one of a very promising sector which is need to be taken care when we are going to do work on halal healthcare, because things remain the same. Life is expensive, and people need to have some insurance policies, a plan to take care of their body and their medical health needs. The final section is the healthcare facilities. In healthcare facilities, we have hospital clinics, we have mental health facilities, we have nursing home, we have care facilities and everything. So apart from like the normal cleanliness, the nutrition and all these factors, halal food is something which is very important to be provided in these facilities. Now, one of the emerging sector in healthcare facilities is the halal medical tourism. The medical tourism in itself is a very big and well-spoken term nowadays. It's a very big industry, medical tourism, and in which Muslim consumers are there. So halal medical tourism is surely a place where we should be discussing how to capitalize on halal medical tourism. So there are some key considerations which should be taken care of if you are having a halal medical tourism facility where you want to cater to the Muslim customers. So you have to provide the basic needs for the Muslim patients, which comes to the core Muslim-friendly services required for the hospitals, which are the halal food first and foremost. Then there should be Qibla direction and Quran in rooms. Then prayer room for the visitors, because all the visitors will be visiting will also be needing to do the prayers. Then you can provide the doctors and nurses at the same gender as the patient. If there's a female, she won't be much comfortable with a male doctor, or a male patient won't be comfortable with the female doctors. So there should be like the same gender doctor patient thing. And then it comes to the medication, as we have discussed in length, how drugs which are halal can be more beneficial for us in the longer run. And then they should be providing funeral services according to Islamic requirement, if required, because the person is traveling, it's not in his home country, in its home, and it's very important for the person to get all the essential funeral services as the Islamic requirement. Now we can have the recommendation for halal medical tourism is that we should encourage. It should be a halal certified, for which the HCF are doing great jobs, and there are lots of hospitals are being halal certified nowadays. And then we can combine these halal medical services with some tourism package also, that when the person is better now, he can visit and do some sightseeing and make it a memorable trip, not just a painful treatment course of action. This way we can have a unique brand identity where we can develop a halal medical tourism. So I think we have covered most of the aspect of our healthcare sector and how the initiative of halal is being implemented in all these. There is a long road for them to be generic, not as a Muslim specific requirement, but something which is good for the whole humanity. And we pray, inshallah, with all our initiatives and creating the awareness, that it will be good for the whole of mankind, not just for Muslims, for non-Muslims as well. If you have any questions or comments or anything, please let us know. Please let us know. I'm just providing here my emails and my numbers, so you can reach out to me for any questions or comments. As I say, I'm not an expert, but I do have many expert friends where we can get a solution of the problems. So once again, thank you so much for listening to me for these presentations, which I have worked during this lockdown with three of my very talkative girls around me, which was not an ideal situation for me to work on a paper, but I did my best, and inshallah it will be helpful to all of us. Jazakallah to everybody, and assalamu alaikum wa rahmatullahi wa barakatuh.